lovelies. Welcome back to Glow and Grow Sessions with Lynn and Kailyn. Today we have our second guest on the podcast, our dear friend and nurse practitioner. She owns Healing Hydration and Wellness and Gaia Functional Medicine. We are so excited to have you today, Jessica.
Thank you.
Can you start us off by giving us a little bit about you and your background, what it is that you do?
Sure. Okay. So I started in nursing. I was late to the game of being a grown up. And so I didn't start nursing school until I was 30. And surprisingly, I wasn't the oldest in my class. So that worked out. But I started nursing. I graduated nursing school at 32 and was in emergency and was in cardiac and loved it. And I just knew that I wanted to do more. So I went to nurse practitioner school when I was 36. And I've been doing it ever since. So I've been in medicine over 14 years now. And then before that, I was into all the holistic herbs and all of that kind of stuff beforehand, which led me to medicine to begin with. So I currently, as you said, own Healing Hydration and Wellness, which is an IV clinic in Vero Beach, as well as Gaia Functional Medicine, which is it's virtually and in person functional medicine clinic here in Vero Beach as well.
So tell me a little bit more about the Healing Hydration and Wellness with the IV therapy. Who is that for? What's the benefits of that?
That's for anyone. Actually, both of them are for anyone. There's a couple of reasons you wouldn't be able to receive IV therapy, and that's with congestive heart failure and things like that. But we are chronically dehydrated in the United States. I mean, everywhere in the world, actually. Like 75% of us are chronically dehydrated because we just aren't interested in water.
So many different delicious drinks.
And that's why, right?
Yeah.
and you think liquid is liquid, it's just not, right? Like you can't give a plant Sprite and expect it to do well forever. You know what I mean? So everybody's a candidate for IV hydration, and it just replaces the vitamins and minerals that we already have that we may be deficient in, as well as we can add some extra things to it. Everything that I give you, you already have in your body, unless I'm administering a medication. Like if you come to me sick, then I can give you Zofran. You don't not naturally have that in your body, but everything else I give you, you already have in your body. And we're just making the levels up to where it is a functional level for you to function.
I have had a few IVs with you, especially during the summertime when I'm sweating my ass off outside at the barn. And you said to me that you deplete a lot of your vitamins through sweat.
You sweat them out, yeah. And if you're not taking supplements, or you don't have the right diet necessarily, you're not replacing those. So certainly your B vitamins, if you're out there just sweating, then everything is going down and your tank is getting lower and lower and lower, and that can lead to a lot of things like the fatigue. Like you said, after the barn, you are done. You got to come home and sleep, and that's just because you're sweating all the good things out. A lot of my patients are people that work out and work outside doing lawns and whatnot during the summer, and they come to me and they're all cramped up and just feel terrible, and we put them on a package where they come and we fill their tank essentially, fill all the vitamins back up to where they're supposed to be, and then they know what good versus not good feels like. So they know that I feel good because all my vitamins are in this place. So when they start feeling bad, they take the necessary steps, whether it's water, whether it's Gatorade, whether it's supplementation, or they come and see me to top them off and then continue supplementing in the meantime.
Yeah, I agree. I've definitely felt the benefits of that. And it's also helped me with getting headaches because the day of being outside, I would be tired. But then the next day, I would have headaches. And it was because I was so dehydrated. I just sweat a lot. I know I have some other friends that just it's kind of a running joke with us of how much we sweat when we're outside. And my daughter always calls me out. And she's like, how come you sweat so much? And I'm like, I just do.
People are just made that way. Yeah. And that's how your body's speaking to us constantly all the time. We just have to learn to speak its language. And you can tell just from your learning your body is that the headache is a way of saying, Mom, I'm thirsty. So we got to listen to our body. It's constantly talking to us. And that's one way.
Yeah. I love that.
Mm-hmm.
So tell us about Gaia Functional Medicine. This is new for you.
It is. Well, it's a labor of love. I feel like I've been kind of doing functional medicine probably the whole time I've been doing medicine, just because I took so much of that herbs and minerals and things that in the past that I studied, and it was just a hobby of mine. And then in the emergency department, I would give little tips like, well, you should try this, or perhaps if you drank this much, or if you added this to your diet, this would kind of stop happening to you. So I think that I've always kind of practiced it. But in the IV hydration, you spend a lot of time with patients. It takes about an hour to get an infusion. And if you sit there long enough, people will start to tell you, it's like a hairdresser, right? Or a makeup artist.
Oh yeah.
People start to tell you what's going on with them, and you, being in medicine, I just want to help them. But my hands were kind of tied because they weren't my patient per se, right? So I wasn't in a medical setting per se. So I just thought, well, I can do more. There's more that I can do with this. There's more care that I can take with this patient rather than just saying, here, take this pill or here, do this. I can really, really work deeply with them on their level and figure out what exactly is best for them. So it's been about a year. Gaia has been in the works, and we finally are established and up and going and ready to take patients. And I'm super, super excited.
I'm excited for you too. I'm excited to be a patient.
I'm ready for you to be a patient. I really am.
So there is a subject that all three of us have often talked about, like gut health.
Yes.
And the benefits of gut health, or what happens when your gut is not healthy.
Yes.
Let's dive in that.
It is a deep subject. So if I get going too long, shut me down. But I want to first say that a lot of these examples that I'm giving you are perhaps not 100% technically right of what's going on. There's neuromodulators. There's that, but these are examples that we can, so you can visually see what's going on, right? Mm-hmm. So let's start with, what do you want to start with?
So I remember recently you said that anxiety and depression be linked to gut health. And that was super, super interesting to me. And I think a lot of our listeners that have struggled with anxiety and depression, and they've been seeing a therapist and they've tried SSRIs. Personally, I tried SSRIs. They did not work out for me at all. Like, it threw me off completely. Yeah. So I've just kind of felt like, well, I guess I just got to tackle my anxiety and depression like raw, and but talking to you and I've had some vitamin infusions with you, and I noticed a difference in my life. And so I'm curious to see how these other tips that you have can really help me and other people, other listeners, maybe even locals that are listeners. They could maybe come and see with this issue as well. So could you give us more information on that?
Let me tell you, let's do a little bit of anatomy just first of all. Okay. So our intestines, that's where all our food is digested. We all know that. You put it in your mouth and it goes to your stomach. It starts to get digested and then it goes digested and then it goes through your intestine. Your intestine's job is to squeeze out all the vitamins and minerals that are in what you're eating, right? That's its job. There's different parts of it that squeeze out essentially the different vitamins and minerals. So if you're missing a part of your gut, then you're not going to be getting those particular vitamins and minerals because that was the spot that did it, right? So that's why a lot of people that have like gastric bypass or a sleeve where some of their stuff is tucked away and the food's not going through, that's why a lot of them can end up being malnourished, is because that part that absorbs that isn't there.
That makes sense.
Yeah. So it's 1 cell thick. And I was trying to think of something. It's obviously microscopic, right? Cells, but microscopic only, but it's only 1 cell thick. It's super, 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 super thin. And it's just because it's supposed to allow the vitamins and nutrients to come in while keeping the bigger things like bacteria or undigested food particles out. It's supposed to keep those out. That's its job. And it works nicely up until something happens. And the 4 things that we like to categorize those are infection, stress, antibiotic use, and inflammatory foods. Those are the 4 things that we look at Gaia functional medicine that could be causing your hyperpermeability, eventually leading to like leaky gut. So if we look at the gut, it's 1 cell thick and it's like a cheesecloth. It's like this, kind of like a grate. It's that thin and it's supposed to allow things through. Well, if one of those 4 toxins, bacteria, stress, inflammatory foods, if one of those 4 come in, it stresses the gut out. And it's that cheese grater, that cheese cloth starts to spread apart like this because it's stressed out. And when it spreads apart like that, things like undigested food particles and bacteria can get into the body, right? Can get into it. And all of a sudden the gut goes, hold on. There's something in here that's not supposed to be here. And it calls all the soldiers, which is the inflammatory response, to come and fight that. So it brings all the soldiers from all over the place, because that's what our immune system does, to come and fight that particular thing. Now, it doesn't necessarily have to be like a bacteria, right, which is one of the things that can make us sick, but it could be something like a piece of an orange that wasn't digested properly because we didn't chew it properly, right? So and then all of a sudden it's attacking this orange, and the orange is not bad for us. It's actually good for us, but because the body sees it as an invader, then all of a sudden you have an intolerance to oranges. That's how you develop intolerance to certain foods.
Wow.
So the ones that were mostly intolerant to the foods are gluten, dairy, and sugar. Those three things. So they're not necessarily bad on their own, but for some people, they just don't work well. Now, is that because they are in fact intolerant and intolerant to that? Or perhaps was there a point where one of those three, well, sugar is inflammatory anyway, but one of those three things got past our barriers, and the body said no, and jumped on it, and then all of a sudden it's the devil from here on out, right? The body thinks every time you take it in, it's not for me, and attacks it.
Wow.
Causing inflammation. And inflammation is clinically what functional medicine is attacking. Functional medicine is getting to the root of the issues and finding out where the inflammation started, if you actually are intolerant to that, or if it's something that if we work on your gut biome, if we get your cheesecloth back together, right? Get the defenses back up, then perhaps you can reintroduce that and actually not be intolerant to it.
I have never even known that or thought about that.
That's the problem, is that if you keep reintroducing it, if you don't know what's causing it and you keep reintroducing it over and over, the body only has so many soldiers, right? It gets tired. So if you think of your gut lining as like a battlefield, and you have something that gets through and our soldiers go and fight it, and then you introduce it again 4 hours later in a cup, let's just say gluten in a cupcake, or sugar in a cup, or dairy in a cupcake. And I'm not saying cupcakes are terrible for you. I'm just saying, like, if you keep reintroducing it again 4 hours later, and then you do it 3 times a day, like your meals, or 5 times a day with your snacks, and all of a sudden your soldiers are tired, bro. Right? They need a chance to rest. They need a chance to repair. So eventually they just get more and more tired. That gets bigger, and then more things get through, and then all of a sudden you're intolerant and allergic to everything. And you don't even know that at first. This is happening on a cellular level when this happens. You only start to notice it when you have things like skin rashes, the fatigue, the bloating in your belly, diarrhea, allergies. A lot of people that don't actually have allergies, the body is just like trying to tell you things are wrong. They're telling you I don't feel good after I ate that. Or I ate breakfast and I'm bloated. This is the way it speaks to you. But we don't know how to listen anymore. Sorry, I just get so hype about it.
No, yeah. No, that totally makes sense. Like, what I'm thinking of is like, you wake up and you're like, oh, I don't feel good. Like my sisters and I always talk about, like, we're the weak tummy girls.
Yeah.
And my mom, like, we always say, like, oh, we got the sensitive tummies. Like, we always have a tummy ache. And we make jokes about it. And it's making me think of that. Like, what is my body trying to tell me?
Mm-hmm.
Like, why do I get tummy aches all the time? Not to like word it like that. That's just my silly little wording. But like, why do I feel nauseous?
Mm-hmm.
Like sometimes I'll just be sitting there and like a wave of nausea comes over you. And that's your body trying to give you a signal that something's not right.
Yes. Because yes, that's the body's trying to talk to you. And we're just not listening anymore because we're distracted by life, by our phones, by the TV, by, busyness in life. And so we're just keep going and going and going and going. And eventually, the body's going to make you listen in a way that could hurt you, right? Could potentially be lifelong. So let's nip that in the bud right now, kind of deal.
Plus, it's hard to make healthy changes in your diet with our society.
Without a doubt. And it's not made for that.
Right.
The society is not made for, I think a great awakening is happening. I think a lot more people are beginning to pay attention and say, no, I don't want these things. No, I don't, these things make me feel bad. What can I do to feed myself better, to feed my biome better, my own little kingdom? I mean, the things that are happening in the body, if you think, the Maybach, or if you think of a space shuttle is amazing, you should take a look at your body. We are so much more advanced than all of that.
Yeah.
That's crazy. It's so exciting to me. I like it.
It is. Yeah. It is. Like, it is amazing when you start to look at all of the little parts of our body and how they function and how they work hand in hand together. And, I worked in I worked for a chiropractor before, and he would talk about like the not having enough salt, how it affects your muscles, like all of those different things. And you think it's your neurons like in your body need the salt to translate messages or whatever. And it's like these little tiny things, little ways of making sure that if you're hydrated enough and you're getting your electrolytes, then you have those healthy salts. But a lot of people are lacking. And so you're saying like with the hydration and wellness business, the healing hydration and wellness, you're helping people get back to a state where they're even with all of their vitamins. And then if they're still struggling, now you can help them further.
Exactly. And I wanted to help them further, and I couldn't just in the IB business.
Yes.
Although I agree, it's to marry the two, right? And it's not feasible for you to be on an IV for the rest of your life. Some people have to, with different disorders and whatnot, but it's not feasible for you to stay on that. So that automatically, it's just like, well, this business isn't feasible, right? It's not going to stay. But to get you to where you are, get you to pay attention to how you feel when your body's at 100%, and then to get to pay attention to know when it's not, and then how to make it back 100. That's the whole goal of functional medicine. Functional medicine starts with the patient. It is patient focused. It is preventative, right? We want to get to it before you get to the sick part kind of deal. We're focusing totally on you as the person. We're using holistic therapies, integrative therapies, chiropractor, massage, energy. We're using all of those things to get you back to 100%, to get to the root of your issues, not just cover it up with a pill, or not just to deal with the side effects. You say that you have nausea all the time. Well, then one of the pills that they would give you would be something like Zofran. But why are we nauseous? Let's get to that. Is there a reason why we're nauseous? If there's something in your gut that's you're nauseous, are you doing something on the outside that's making you nauseous? Are you eating the wrong foods? Let's get to the reason why that is. And that's essentially what functional medicine is, getting to the why, and then let's change it.
I love that. And something's coming up in my head. So when you were talking about you're giving a patient this IV infusion and they're opening up to you, I think about like people that I know that are nurses or like in the medical field, and they say that, and like, let's say you're at a birthday party, and then like all of a sudden, like you have people coming to you and like saying like, oh, well, I have this problem. And to me, if we're talking about something like, if there's the squeaky wheel gets the oil, right, in our bodies, like society, the people that are saying like this issue, it's almost like they're opening up and showing that there is an issue with the doctors in the fields and the way that our health system is working right now. As you were saying, like, it's like, I don't feel good, I'm going to give you Zofran. I can't tell you how many times I've been to the hospital, to the doctor's office, and I have a high pain tolerance, and I'm somebody who was raised by a dad that was like, I'm gonna super glue that closed. You don't need to go to the doctor. Okay, so I'm not a doctor goer. And then when I go to the doctors, a lot of times I felt like they were just putting a Band-Aid on it, or that I didn't like get the answers or the time that I needed. And so then I'm like, well, what's the purpose of, I'm just going to chug along and try to ignore all of these issues. And then if there's a big enough issue that arises, then I'll try to go back and have them slap a Band-Aid on me again.
Sure.
And I think there's a lot of people who are feeling that way.
Yes.
And so with your work and you sharing this stuff on social media, I think that you see this wave of movement of people wanting to change, and a cry out from society saying like, we want to be heard.
Yeah.
Like, we don't want to live like this. Like, how can I avoid this? Like, our healthcare system isn't doing what I need. And there's such a need for it right now. And with your work, there's the potential to like reprogram people to see medicine in a different light. And I think that's super important. It's really interesting to me, like, all of this coming together to see like what you and your vision is all about.
Yeah.
And I think that's like super important. And I think there's such a need for it. I guarantee 95% of people that are listening to this right now have are shaking their head going, I have totally felt disregarded at the doctor's office. Of so many different kinds.
I understand and I believe that. Let me just say this. I work in traditional medicine as well. It's where I started. And I love traditional medicine. It has its place. It definitely has its practice. It really does. And I love saving lives. I was in the emergency. I love all of that. But I did notice that they're not doing it to hurt you. I can guarantee you none of us got into medicine to be like, let's hurt them. Let's
throw some band-aids on.
Let's throw some band-aids on. Nobody went in there with their box of band-aids when they graduated med school or, whatever it was. This is how I'm going to.
They just want to help you.
They want to help you. But there's a lot of these issues are so deeply rooted that they do not have the time to get into every single patient the way that you need to be gotten into, that's not right English, but that you need to, as deeply as you need to. They just don't have the time to do it, because they're doing like sick work and, things like that. So they just don't have the time to get to every single one of them. So that's where functional medicine is coming in. I'm hoping to say that people that are serious about wanting to change and are serious about being listened to and then ready to make those changes, because they're not always comfortable changes. Some people are going to be like, you mean I can never have dairy again? Well, I'm not saying that, but what I'm saying is while we try to figure out what exactly is causing your symptoms, you have to go on an elimination diet where you just eat possibly 4 things for 1 month, and that's it. Just 4 things for 1 month. And then when your system calms down and stops being beat up every day, right? Those new invaders come in to hit your wall and make it thick. Then once it calms down and it stops being inflamed, then you introduce one of those things back. And then you'll know, oh, darn, it is the insert whatever. Let's just say gluten. It is the gluten that's doing it. It's the gluten that makes me feel this way because I ate it and then I listened to my body. It made me nauseous. It made me bloated. I couldn't poop. I pooped too much. I threw up. And then that's how an elimination diet works. So you have to be really dedicated to wanting to change. And I think that we're getting there now. We're finally getting there now. And I wanted to be able to escort you on that journey while you do it, because a lot of medicine needs translation. So basically I'm a translator for you because I speak both languages.
You're speaking to me right now. This year was the first time that I really got serious with my diet. Now, I have Hashimoto's hypothyroidism. I've had it since I was 16. And I started to follow this nutritionist who heals, or not heals, but essentially she helped women heal themselves from that. And one of the biggest things is she says, cut out dairy, gluten, and eggs. And I've been doing that probably since June. I haven't been like 100%. I still have my gluten here and there, but I have noticed when I go longer without it, and then I do have like a piece of pizza, I am bloated and I'm gassy the next day and I feel like garbage. And that is also causing inflammation within my autoimmune disease.
Yes.
And so like I have all these things going on, and it's been interesting to learn all of this.
Well, they all marry, right?
Right.
All one thing. So if you're bloated in your gut from either of the 4 that we talked about, toxins, inflammatory foods, antibiotic use, and we can get into that in a minute. And then sugar. No, inflammatory foods, toxins. It'll get stress. Thank you, babe.
Oh, I remember that one.
Yeah. If you are fighting that all the time, so here's the next part of the education, and I realize this isn't in order, but this is probably, if you thought the other part was cool, wait till you hear this. So there's something called the vagus nerve. And usually you would think what happens in vagus, but this is what's very cool. The vagus nerve is the 10th cranial nerve, and it's a nerve that goes from your brain to your belly. It's one nerve that goes along. So, and in the meantime, it's branched out into your thyroid, it's branched into your adrenal, it's branched into your lungs, it's branched into everything else, and then goes up to your brain. So the whole reason the new way of thought is the brain is the stomach is the gut is the second brain is because think of your brain as the COO, right? She's the ideal woman, right? She's the one that says, I want this to happen. And then she gives that to the COO, the chief of operations, who actually does the work. The guy is the COO that does the work. So it says, I want this. And then the guy goes and tries to get it done. There's so much inflammation going on that's happening down there. And then it's going to go tell the brain, hey, boss, we got some got some real things going on down here. We need more we need more soldiers, right? That we need more of this, we need more of that. You know, it's telling it all of that. In the meantime, it's traveling up this entire, and it's passing all those the kidneys, the lungs, the thyroid. It's passing along all of that, and that information that we're inflamed is eventually going to spread to all of those places. And then eventually they're going to be all essentially. So it's a lot deeper than this, but it's essentially all what's happening down there is going to spread to all those places. So what we found is when we start to get your gut biome under control, the inflammation there in control, then all of a sudden your other autoimmune disorders, right, start getting better because we're not inflamed down here. Then the information is like, hey guys, we're starting to calm down. We're okay. We're getting the things that we need. Perhaps you can calm down a little bit. Now, that doesn't mean it's going to go away all the way, but it can definitely be better. And auto means health. So autoimmune is you're attacking yourself. Well, eventually, as we're going back to that piece of orange that gets through, and then you're attacking that, eventually the immune system, because we keep introducing it over and over and over again, and oranges are getting a bad name in this. It's not necessarily oranges, but we keep introducing that inflammatory whatever over and over again, inflammatory product over and over, that eventually the body says, I don't even know what it is. Attack it all. That's what autoimmune is. Autoimmune is. I don't even know what's going on. Soldiers everywhere. Soldiers everywhere. We're fighting everything. We're fighting ourselves. It doesn't even recognize self anymore and just attacks it. So once we get it to calm down in the most important place, which is your gut, the second brain, then eventually those other ones will be like, oh, my bad. You're me. Okay, we just won't, let's not fight anymore. And so those numbers get better. We've seen them get better. Symptoms, and inflammation also begins to show on the outside, the puffiness, you know, all of that kind of stuff. That all starts to go away when there's not soldiers everywhere fighting, right? When you're just in a good spot, those numbers get better, and we don't attack ourselves anymore. It's not a cure. It's not I'm not saying we're curing it. I'm just saying that once the biggest one gets under control, then all the other ones tend to say, oh, okay, I get it. I understand. Yeah. Because when you're constantly fighting, you just start fighting everyone. You don't know.
Yeah. So this is traveling all the way up to the brain and can cause mental health issues.
Yes.
So let's talk about that.
So the four things that we talked about, things that we talked about that are antibiotics, stress, inflammatory foods, and I can't drugs. No, I already said no drugs. The other one, I don't come to me. So antibiotic use, 80% serotonin. I'm pretty sure we all know, but if we don't, serotonin is, it makes you happy. It's one of the chemicals that make you happy. Right. And so you can go get on medication, SSRIs, serotonin uptake to getting more.
This is getting really, really, really interesting for me.
Yeah.
Okay.
Yeah. But if you did things that were like your gut wasn't in the right spot, there were toxins that you used, and then you use antibiotics more than 3 times in your life, then yeah, and it's not your fault. If you did, it's not your fault. We didn't know, right? But let's just start over. Don't be down on yourself. Sometimes it's my mama gave me 3 rounds of antibiotics before I was 2 because I had ear infections. Then the 80% of your serotonin is made in your gut.
Really?
80%. So if it's messed up down there, if you use antibiotics and cleans your gut biome, right, cleans all the bad and the good, if you do a broad spectrum, it takes both of them out, and then the bad ones come in and they grow faster than the good ones. So that's why you kind of do need to do probiotics and all of that to get your gut biome right. But if you wipe that all out, 80% of it is made there. So those transmitters aren't doing so well. They're not making what they're supposed to make to get to your brain. So if 80% of them are there, and this is in a ruckus, and the cranial nerve, vagus nerve, from here talks to here, then it's telling it.
And you can so I struggle deeply with anxiety. People know this about me. I've gotten to the point where I openly share about this because I know that there are so many people that struggle with anxiety, and I think in us talking about it and sharing, it makes other people feel more willing to accept that they struggle with that, and that, this is a normal thing. You're not the only one, all of those things. So I'm pretty open about it. I also have ADHD. And I know that ADHD, and I'm not like, I know that it does something with your serotonin, if I'm correct. Like you're not getting enough of, or no, you're not getting enough of like the happy hormone production that's part of ADHD, if I'm right. If I remember watching something where they were talking about people that have ADHD don't get enough of like the happy hormone. Adderall kind of helps with that. And I had a major kidney infection when I was younger, E. coli, pretty much left scar tissue on my left kidney. And so I was on some really super heavy antibiotics. And so that's why I'm like, wow, all of this is kind of like, check, check, check. I'm checking off the list in my head. Like, wow, I can totally relate to this. But and a lot of people that struggle with anxiety will know, you feel it in your, like, that's where you feel it.
Of course.
And so that's what you're talking about this. And I'm like, oh my God, oh my God, oh my God.
Yeah.
But you feel it there. It starts there. And then you start to sweat. And then it's in your head and you're, like you're chirping and your heart's going and all of those things. And if you have generalized anxiety disorder, it's not thought anxiety. So that's what I try to explain to people, because like some people will say, oh, you have anxiety. Well, like just take deep breaths and like, just don't worry about things. And it's like, well, I wish that would work. But if I was thinking of something specifically and I could stop thinking about it, that would be wonderful. But I'm not thinking about anything. This is a state of being. Like, it's not, oh, I thought myself into feeling this way. It is this is my natural state of being, or what I believe my natural state of being to be.
Right. But what if it's not? What if 80% of the reason of that is because your belly is sick? Your belly is your gut is sick because your gut doesn't have the things that it needs to make the serotonin to travel up your little nerve to your brain to say, I'm happy. What if that's the case? What if you have damaged the gut so badly, unintentionally, right? Unintentionally, that it's not working appropriately? Wouldn't you want to give yourself, wouldn't that be something you'd want to check off your list to say, you know what? It turned out it wasn't my gut, but I bet it will be.
Yeah.
I bet that it will help exponentially. Maybe not cure it, no cure, but it will help it.
Yes.
Once you get this going, your second brain that is telling you, this is the way it's telling you it's safe. Now you're listening.
Yeah.
Because you know that, wait a minute, is this trying to talk to me this way?
And it makes sense.
It's a step in the right direction to check your gut health.
Yes.
Yeah.
Yeah.
And if you can help yourself with eating better, with taking your vitamins, drinking your water, exercise has been a major plus in my life, I think, because of ADHD, because when you work out, it releases like happy endorphins and all of that stuff. So it's really helped me with my anxiety and my anxiety and my ADHD. And so as you kind of start to help yourself, you start to look more to things like this, where you're like, I can make these changes for like these healthy lifestyle changes so that I can actually be a happier person without any of these other side medications. Or not that there's anything wrong with those medications,
there's not.
because I know people who take SSRIs and it works for them and they need it. But for me, it did not. And I'm very sensitive to medications, with all different types. So our body chemistry is different. And so there are a lot of people out there that are looking for a way to feel better without the medication. So I think that's super exciting.
This is very interesting. I love this whole conversation because our bodies are so powerful. We literally create life, which means you can heal yourself. If you are feeling that this is speaking to you, then you are that person. Because again, like you're both saying, this isn't for everyone. Some people do need the medicate, like I have to have my thyroid medicine. I can't just go off and be like, okay, I'm going to heal
Gotta go down.
myself,
Yeah,
you know?
no, definitely. And we're not promoting that. I know your functional medicine providers will never take you off of medication that you've had from your traditional primary provider. We don't want to do that. What our goal is that hopefully, and this is going to take a while, you didn't get quote unquote sick overnight. Okay.
Yeah.
So this isn't going to be a month long. This is going to be a while process, right? It's going to be anything worthwhile takes a while.
Yeah.
So this is going to be our hope is that we start here with these numbers, which we're going to get when you come see me. We do tons of labs. There's stool tests where I can look and see. You could, in your gut, you could have parasites. You could have SIBO. You could have, we'll do some stool tests to figure that out. And then we'll get for instance, for you, we'll get your thyroid numbers. And our hope is that after we do this process and you're feeling better and your numbers are all good in your gut, then we'll test your other numbers again. And then maybe we'll be able to go down on your thyroid medications because the inflammation has gone down. The thing that's telling it, no, you're sick, has gotten better. So the hope is maybe you'll be able to go down on the levels of those medications. But if you can't, you can't. And that's okay too. It's still a win. You're still winning. Your gut is still in that process, is still healing, it's still giving you the happy thoughts, it's still doing what it's supposed to do, and you're not inflaming it every day. And then you walk around with more power and control over what is going to hurt you. I can't have that because it hurts me. And I'm not saying that you can never have dairy or gluten again. Let's just go back to the cupcake analogy. Once your gut is healed and your junctions are back together and all of that is good, once that is healed, then have one. But you may not like the way you feel afterwards.
Yes.
And then say, it's just not worth it to me to have it anymore. So I'm just not going to have it anymore. But if you do, then you do. But you're in control and you have the power of knowing that if I eat this, I'm going to feel this way. And a lot of people will choose not to. Some people say it's worth it. Let me smash into this cupcake. That's fine. Smash into it.
Yeah.
But just know how you're going to feel. Yeah, there's power in that as well.
It's listening to your body. What is it like? What it doesn't like? How do you feel afterwards? Being in, that's what I'm looking for. Being in connection with your body is basically what this is.
They're so connected from our bodies these days. Yeah. And they are, just like you said, they are such beautiful, we're just looking at women wise, right? They're such beautiful people that we can create life. And this happens, this amazing things happen in our body every month. And it's just wonderful. But I mean, just overall, the human race, we are so disconnected from our bodies due to distractions. And it wasn't ever like this. It wasn't probably for the past 100 years that we became super disconnected because of technology. And I love technology. It's great. I'm not like artificial everything. I'm not like live in the dark, but let's maybe get back to the rooted issues and a lot of this artificial foods, artificial things that we put in our bodies. Let's not do that. Let's feed it with whole food. Let's feed it with food from the ground. Not preferably or organic, right? Because Roundup, glyphosate is like the number one ingredient in Roundup. That's one of the toxins that we're talking about. So if you're going, you're eating salad, even if you're eating salad at every single meal, and it doesn't have to be salad, but just easy. If you're eating salad that's been sprayed and like the number one ingredient in Roundup, you're just introducing toxins and again. So your diet could be, yes, I eat, but are you ingesting those chemicals that way, right? So that's where organic comes in. Clean foods, non-GMO foods, things like that. But, just also know you can be doing all of these things right for your body. And then on your way to work, you pass a cornfield that's being sprayed around. So it's just coming from us from all angles. So the best thing you can do is eat clean with organic, non-pesticide, vegetables. And then there's a plethora of things we can do, and you come see me and we'll go through all of those. And it's a lot of education, but it's definitely worth it.
Yeah, I mean, I haven't been perfect with my diet change of doing the gluten, dairy, and egg-free. I've been really good with egg-free. That's easier to take out than the dairy and the gluten. But I have noticed a difference in how I feel. I don't feel like my body has changed a lot in the past few months. I mean, some people have commented that I do look like I have lost some weight, but the scale isn't dramatic, but I do feel different. So maybe what I'm doing is helping with the start of healing the gut because I'm taking out the inflammation, and therefore my mentality is getting better.
Mm-hmm.
So what are some ways that we can improve the gut and the gut brain connection.
So just some of the things that we talked about, right? We're going to increase our hydration. Number one, it's so important. It falls from the sky, right? Water falls from the sky. That's how important it is, because whatever you believe, God, artificial, whatever you believe this happened, it falls from the sky. It's the one thing that we cannot live without. You can live a long time without food as long as you have water, right?
Yeah.
So proper hydration. You got to think of it like putting oil in your car. If you don't change your oil and it runs out, and all of a sudden you start kinking up and things don't work right. So that's the same thing that happens to your body. And another thing that I think is really cool about the body is that if you don't give it enough water, you need water for everything in your body. This takes water, blinking takes water, your heart takes water. If you don't give it enough orally, like through drinking, it will go into your gut and take it out of the food that you eat, because everything you eat has water in it. Even like Takis, don't eat those, but have water, eat it if you want to, have water in it. So it goes in there and takes that water out of there to make other things work. But it also inversely works. So a lot of people who have gut issues or autoimmune issues have a lot of dry eye, and that's because the body will go in there and take that water out of your eye and take it to where it needs to go.
And that explains why sometimes my eyes water, which watery eyes is a sign of dry eye.
Right, because it's flushing.
It's trying to moisturize them. Yep. And people will think, well, how come my eyes be dry when they're watering all the time?
Yeah.
That's what your body's trying to hydrate it.
So fluid, number one, right? Then we got to figure out the toxins that you're breathing into your body, whether it's the Roundup, quote unquote Roundup, whatever's going on in your food. So that's one of them. If you're smoking or any sort of vape, anything like that, that's really inflammatory to the body. There's nothing good or in any of those, right? So the body, and when you continue to do it to the lungs, it goes everywhere, right? And then stress, got to work on our stress level. When your body constantly thinks a bear is chasing it, then, this to the gut biome, the cheese cloud, not important. Living is important. So everything just goes crazy. And if we have uncontrolled stress, unproportional response to stressors, the body's going to think that we have a bear chasing us all the time.
And being in cortisol all the time causes inflammation.
Exactly. So that's just another way. If it's not the food, then we got to go up to the cortisol and, coffee, things like slamming big coffees in the morning. And then, your body thinks it's a bear. It doesn't know that I just had, a huge cup of coffee from Starbucks. It thinks, oh my God, a bear this early in the morning? All right, let's go. And then that's where the big crash comes from, because it gives you all that energy to run from the bear. We don't need all that energy. There is no bear. That's what we're saying, right?
Yeah.
So it's controlling stress. It is controlling that, getting your sleep. So much happens when you sleep. It is amazing what happens to your body when it sleeps, and it goes through and repairs everything that we fix throughout the day. So if you don't sleep enough and during the right times, which is about 10 p.m. to 4 a.m., if you don't sleep during the right times and sleep well enough, then the repair doesn't get done on that body part. And again, not everything they say is scientifically what's happening. This is just to make it relatable, but essentially, if you don't sleep during that time, then that body part doesn't get repaired. And if you keep not getting repaired and keep not getting repaired because you're not getting your sleep and not getting your rest, then eventually it breaks, like your car.
Like ignoring the leaky faucet.
Yes, exactly. And then all of a sudden, you got a bigger problem. Yep. So sleep is so important with that as well. And then figuring out, again, through functional medicine, what the root cause of it is. And it will probably be different for everyone. You may actually be allergic to gluten. You really may be. Or you're allergic to the way that we conventionally have processed it now, right? Mm-hmm. You may be actually allergic to peas, but maybe not, right? So let's get to the root of the issue and figure out what it is. And one of the reasons, like taking one of those, I don't want to do the name brand, but one of those like allergy testing things that you get from the store, and you test them and all of a sudden, you come back and you're allergic to 30 things. Well, I mean, are you really? Or are you just inflamed, right? So everything you're eating, it's all going to be positive as an inflammation, because it doesn't know, oh, this is chicken, guys. It's fine, let that pass. It just says invader and goes to get it. So that's when we do the elimination diet, and then we slowly introduce things back in to see how they work. And essentially, you are the driver of this, because I can't tell you how you feel. Yeah, in a month, I can't tell you if you eat chicken and you feel terrible. You're going to tell me. I ate chicken probably better. But I ate chicken and now I feel like this. Well, maybe that's one we cross off of our list, or maybe we need a little bit more time away from it. There's some things that we need a while to break up.
There's somebody in our family that every time he eats beef, it runs right out of him. And it's steak. He can have ground beef. It's not so bad, but if he eats a steak, it runs right out.
You know, a lot of times that could be from a tick bite too.
Really?
Yeah.
Oh my God.
Yeah, I'll have to tell him that.
We'll do that and we'll talk about that in another one. But that's a recent thing that's definitely, that's true. Like there's a certain tick bite that is making people have a hypersensitivity to red meat. It's weird that it doesn't happen with ground beef though. But
I think one of my friends has that golden. But so this is just making me think of reminding people when you just said like you're the driver. As you were talking this last statement, it was making me think about, it's true. You have to advocate for yourself.
Yes.
Doctors are busy. Like we were saying earlier, it's not that they're, ignoring you. It's that they have a whole bunch of people coming to them with the emergency. They can't go back 10 years and tell you every little thing that's wrong, right? It takes you, yes. So it takes you fighting for yourself and getting into the right spaces and seeing the right specialists to help you with those problems. And I never knew that until I had my son Rocky, and he had acid reflux.
Mm-hmm.
He was born premature, and I would feed him and I would put him down and he would wake up gulping, and like I could hear him like he threw up, and then he's a newborn and he's gulping it down and then screaming and crying in pain.
Yeah.
And so I took him to the doctors, and the doctor gave me antacid medicine for him. So I started giving him the syringe of this antacid medicine, and it was working for the acid reflux, but then he started to be constipated.
Mm-hmm.
And I went to the doctors again and I said, he's constipated now. And they were like, well, it's normal for newborns to, not be regular with their poop, and I'm like, no, he's trying to go, but he can't go.
Mm-hmm.
And it just was like this vicious cycle. I would stop the antacid medicine and he would be able to go to the bathroom. And then I'd put him back on the medicine because he's having acid reflux problems, and now he's not pooping again. And it just it was like one or the other.
And he got breastfed, not on formula too, which is still be the best.
I was like at my wit's end. I contacted my lactation specialist because I felt like, okay, the doctors are trying to help me. They see my baby. They see that he has this problem and this acid reflux, he can't sleep. They're trying to help me. And, the constipation is a side effect of the medication. Yeah. So it's like, what are we going to take?
Right.
So then I thought, okay, well, if this medicine is not helping him, so is there another route I can take? You have to be looking for those routes too. Your doctors don't have all the answers for you. They have how many patients that they're trying to take care of. You have to also work for yourself. You have to show up, just like I worked for my son. I contacted my lactation specialist, and she said, we have to cut out all the stuff from your diet.
Yeah, exactly.
So I had to cut all the stuff out of my diet, and I did it. And I breastfed him, and we were still having the problems. So I knew that there was still a problem, So I contacted a chiropractor, and I was so nervous to contact this chiropractor. I remember telling all my friends and family, I think I'm going to take Rocky to a chiropractor because in all of the groups that I'm seeing, that's where I should take him for acid reflux. And my husband was like, I don't know about that because we're thinking popping, cracking, like we adjust this.
There's so much more than that.
Yeah. And I didn't know. And so I'm thinking, I don't want how is that going to help? How is cracking my baby's back, going to help him with, his acid reflux problem? Well, it saved him. It saved me. It saved our night routine. It changed everything. It got him off the antacid medicine. We did 2 adjustments. She did a diaphragmatic release on him. So she massaged his stomach, and she explained to me that when a baby is born, they sort of go through that type of adjustment as they are going out of the womb because of the way that their body is compressed. It squeezes their diaphragm down and it sets it into the proper position. But when a baby is born by a C-section, it's not the same. You don't get that same pressurized pushing the fluid out of the lungs. And so it can cause all of these different issues. And so she said part of the reason why he was having trouble pooping was because he didn't have the diaphragmic, the diaphragm in the right position to press down. And then the acid reflux was because the diaphragm was so high up. And so we went 2 times and he never had to take the medicine again. He never had problems going to the bathroom again. But it took me going, okay, that's not working. That's not working. That's not working.
Right.
And sometimes the answer, sometimes medicine does help and it does what you need to do. But sometimes there are other routes that you can take, and it takes you reaching out, go online and look for doctors like what Jess does, to help you with those problems. And they're out there and they want to help you and they want to listen to you. And I think that's super exciting for some of our listeners to hear, because I know that they have felt that way.
Yeah.
I know I felt
that way, which is why I went into medicine to begin with, is because I felt that way as I was listening, and then I transitioned to this. And I work very closely with some chiropractors here in town. One in particular that we are just on the same page as far as holistically integrated medicine, and we're using several different facets because not one person can be all to one person, right? So I work very closely with one, and we tackle treatment of patients with dual treatment plans, and we're going back and forth. You do this, and then they come to me, and I do this, and you do this, and it's not. We're not trying to farm it off to one another. We're not trying to say, "Oh, this is too much for me." We're trying to say together.
Yes,
it takes a village to raise. It takes a village to raise a child. It takes a village to continue to take care of yourself, right? And go. It takes a community of people that know how to do different things. Just like there used to be a butcher, and then there was a hat maker, and then there was a bread shop, and there was that's the same way that you have to look at your health, right? And I can't get everything from one person. And I think it's kind of an unfair onus that we've placed on doctors, that they're supposed to be the end all. They know how to do everything and be the end all, fix everything.
Yeah,
and they can't.
That would be like expecting me as a makeup artist to solve people's self-esteem issues. I cannot undo that in a day. I cannot. You come to me that day.
They're not more beautiful.
Yeah, I can fix you for today. I can make you good today. I can make you feel good today. I can make you feel beautiful today. I can make you feel confident today. I can give that to you today. But I cannot heal the fact that you dislike the way that you look, and it is 10 years of a horrible husband or partner or abusive relationship, or an illness that you're experiencing that has taken, the life from your face or whatever it may be. I cannot undo those things, but I can help you for today.
And that's how doctors feel when you go to see them.
Yeah.
Right? Doctors, nurse practitioners, whatever your provider is at your primary care or specialist office, they can help you feel good today. That's why you got the Zofran.
Yeah.
Right?
Yeah.
It made you feel good.
And it did
today.
It made
it does work. I'm not saying we're not taking off. I'm not saying it doesn't. But let's get to the reason why that's happening. And that's where functional medicine steps in. Is let's get to the reason. You want to feel good today? Go to go there and get the pill and get that done.
But if you want it forever, go see a therapist.
For you,
right? That's what it is. It's like
we're doing functional medicine for
exactly. So like if the therapist would be like your position or medicine, because it's like a therapist is going to help you figure out why are you unhappy with the way you look, like what all the little events that happen to get you there.
Dieting, because it's a lifelong.
All the internal messages that you're sending yourself and interpreting, and that is all done with a therapist. And it takes a long time. You don't just go to a therapist for a month and go, okay, I'm better now. Like I'm healed and I'm okay.
Because it didn't.
That doesn't work. It takes years of going, okay, I can't do that. That triggers me. So it's basically, we're looking at very similar things here in a way, but 2 totally different worlds.
Right.
But that it's making a lot of sense to me. making a lot of sense.
I agree. Functional medicine for me is additional to. So I'm not going to stop seeing my primary who gives me my thyroid medicine and does my checks, but I'm going to additionally see you who's going to maybe do the extra testing that they don't normally do and dive a little deeper into that and see what I can do to help heal. Maybe I'll never be off the medication, but I can get it lower and I can be on it and feel good, because there are times where I'm on it, don't feel good.
Yes.
And that's really the goal, is just to feel good. I don't care if I take medicine or not. I've already been on it for how many years? 20 years? I can literally just said 20 years. I've been on it for 20 years.
Diabetes, like people changing their diets and exercising, can't they reverse if they're like on low doses of insulin or my father-in-law was, borderline diabetic, and he walks a lot, miles every single day. And his doctors are like, you can stop taking that.
So you don't just reverse it, right? You don't, well, I mean, your numbers can go down. So a sense for reverse, right? You don't ever actually cure it. Kind of once you've gotten there, you've been there, and then you go back. But with the proper diet and exercise, you can reverse those numbers. That you get into a place where you're in a safe zone and not have to take the medication anymore.
Yeah. So see, that's kind of like what you're saying. Like, there's ways of, helping your body naturally and also using medication. But if you do want to lower that, because with taking medications like insulin and things like that, there are risks that we take when we take that medicine, correct?
Like, there's side effects to every single medicine, but there's side effects to herbs and different things as well. There's side effects to every single medication that in some way you're going to have to pay for at some point. You're going to have to pay a pipe. So you're taking from Peter, but you're going to have to pay for all in a little bit. So if you want to stop paying people, you just got to get to the root of the issue and figure out what it is. And then perhaps you won't have to be on it, or you take a less amount, or if the amount you're taking is fine, you're just now tolerating it better and able to feel better than before.
Yeah. So we've talked a lot about gut health today and what it can relate to. What are just a few, like a short list, a few other things that you focus on or can help people with in Gaia Med?
Okay, yeah, Gaia does get about, but I work primarily in gut health, but I also do hormone therapy for women. The reason that I really got into that is because when I was 35, I started going into perimenopause, and because I work in medicine, I knew what the symptoms were, right? Mm-hmm. So I was just like, oh wow, I feel terrible, brain fog, or achy hands, hair loss, bloating. My menstrual cycles were unreal. It was terrible. I just felt terrible. So I went to my doctor and I had labs drawn, and I guess I should say provider, because but I went to my provider and had labs drawn, and they said to me, your numbers are fine. You're not in perimenopause. And I'm saying, I'm telling you that I feel terrible. And they said, well, what do you want us to do? Your numbers are in the right range. Well, there's a disconnect, because this may be fine. Perhaps they haven't caught up. Perhaps my number hasn't caught up yet, because my body is doing exactly what it's supposed to be doing, compensating, right? Mm-hmm. Working overtime to keep these numbers in the range. So let's treat the patient and not just the number. If I'm telling you that I feel poorly, let's work on how to make me feel better, right? And that's what functional medicine is. So I'm in medicine. So for them to, I went to my colleagues, and when they said, we can't help you, I felt the frustration of a patient and just said, fine, I'll do it. I'll do it myself. And so I did. And that's why I kind of fell in love with this. And it was a long process, but ultimately I learned so much more about myself. I listened to my body. So I do women's health hormones, mm-hmm. the thyroid hormones. I do that as well. Mm-hmm. I also do, I focus on those women's hormones, thyroid, gut. I can also do autoimmune. We can work with a lot of autoimmunes, because the gut and the autoimmune, just like we talked about earlier, they're first cousins. They're super close. Yeah. A lot of autoimmune. I do some stuff work in spiritual crisis as well. That can actually cause, because of the stress, that can cause a lot of upheaval in the body. So stuff like that.
And I think you also mentioned in the past, or even in this conversation, sleep. You do some.
I do. Well, sleep is just the best. Sleep is the most wonderful thing. And if you can't sleep, there is normally a reason why. So, and sometimes sometimes it's in the body. It's the body keeping you up saying, I can't sleep because I can't sleep because. So I do have a program on sleep that is phenomenal. And I do a lot of work with that too.
Yeah, because you touched earlier is when you said how important sleep is.
It is so important. It is. So many people just kind of think it's you just cast it off, but only in the past probably 100 years of sleeping an issue because people were staying up all night, due to inventions of light and electricity and whatnot. And I feel so badly. I worked in medicine. I worked 24-hour shifts and worked night shifts and things like that. And a lot of night shift workers end up having a lot of health problems that maybe don't have to be as bad or didn't have to get all the way there if they didn't necessarily work those shifts. So it's very difficult to say to them, medicine is 24 hours. You need the people in the emergency department to do it. You need to have those people. So the balance is very hard and you can do it. You just have to make sure on the times that you're not working, that you're really taking care of your system and taking care of you in order to give it what it needs so it can give you what you need during those shifts.
Yeah, because our bodies are designed to get up when the sun comes out and go to bed when the sun goes down. But now we have electricity. So we're staying, like, I'm a night owl. I probably shouldn't be.
Yeah.
But I sometimes don't go to bed till midnight.
Yeah.
Most nights 11, but some can be midnight, some can be 1 o'clock in the morning. And I wake up at 7.
Yeah. So you think about what's repaired. In theory, what's repaired from 10 to 1 doesn't get repaired.
Yeah.
The way that it needs to get repaired. Right? Because when you're asleep, the brain's only job really is to breathe. So it just flips that switch for you to breathe, and then it spends the rest of the time doing everything else, fixing, repairing everything else.
Wow.
So if you're not asleep during that time, then it's not getting it as good a repair.
I'm not getting my updates.
You're not down on your updates the way that you should. Yeah, and some people are night owls, and it's kind of different for everybody. I happen to be a morning person. I like to get up. The sun rises, I'm up. I'm that kind of person, and I like to go to sleep early. Sleep can be affected for a lot. Hormones can affect a lot of things.
Mm-hmm.
Sometimes for women, when you're going through the perimenopause area or menopause age, sleep is you can never find it. And there's a lot of things that we can do to help with that, so you don't have to take the pills or things to help you sleep. And it just is going to take some dedicated changes from you, maybe changes in routine. To set yourself up for it, because your body loves to be loved. You just have to learn how to love it kind of property. So setting up like a sleep routine where, it's out an hour before, sometimes even 2 hours before, you really got to set the phone down and then maybe draw a lavender bath, and relax and put on your magnesium cream. I put on magnesium cream every night. Almost all of us are deficient in magnesium. Just because we don't get it in our diets the way that we're supposed to. Magnesium helps us sleep. Magnesium has over 600 uses in the body.
Wow. I need some of that cream.
Sleep them. Yeah.
Is when I worked at the chiropractic office and I was pregnant with my first son, the nurse practitioner that ran the business, she gave me magnesium spray for my feet to help with my nausea. Yeah, and she did work.
Yes.
Because I was
interesting.
Sick as a dog. I mean, I was showing up to work throwing up, and I would get neck adjustments because the chiropractor that worked there, he refused to adjust the rest of me, but he would adjust my neck to help with the nausea, and I would use the magnesium on my feet. So I know that it can help with like nausea too.
Mm-hmm.
So being adjusted during pregnancy is very dangerous. You have to go to somebody that is certified in that particular one. And there is one, I know a couple in town. The one that I work with closely is Dr. Brittany Hughes at Riverside Chiropractic and Wellness. She is certified to work on kids. Like, she would have been the one that would have helped. Yeah. I think she works with pregnant women because there's just so much weight bringing you down, right? That how would you not end up having problems? It's a whole repositioning thing. So if you're certified to work with those kind, and that's the provider that I was talking about earlier, Dr. Brittany Hughes, where we go back and forth with patients. She calls me and said, "Hey, I really think this person can help you, or you can help this person." And then I think that this, so it's great to have other people in.
Yeah, so that's another great thing that you bring to the table is having these relationships with other specialists, people specializing in things. Like you have these other minds that you can kind of pick on or like send them over to so that they can really target and the issues that they have.
Right.
Because everyone has their specialty that they do. Like even when people come to us, my specialty is the connecting and taking their photos, and Kaylyn's part is getting them ready, making them feel good about how they look. She can't do what I do, and I can't do what she do. Like, I could try to do their makeup, it's definitely ain't gonna look as good.
Yeah. But together, you made a beautiful product.
Right. Yep. I have really enjoyed this whole conversation. I feel like we can just keep going on and on and on, but we should cut it now.
We'll have Jess back down.
For sure. Before we go, how can everybody find you, get in contact with you, like your social media handle? What's the best way to?
So for either one, Gaia Functional Medicine is the same on all platforms. The only one I think I'm not on is X, but it's at Gaia Functional Medicine, Gaia, Gaia Functional Medicine, GaiaFunctionalMedicine.com. And then Healing, Hydration, and Wellness is pretty much the same on all of them. www.healinghydration and to spell the and wellness.com. Healing, Hydration, Wellness on Insta. Both of those ways. Or you can, call me at either one of my places and set up a no charge consult. We'll start with a no charge 15-minute consult where we talk about, you tell me what your biggest issue is and I tell you I can help, and then we can, go forward from there. At this point, I'm only taking 20 patients at a time, because if I took more, I wouldn't be able to give you the time that you need for you. Right. So if I do any more than that, then I'm going to be cheating. I feel like cheating my patients. So only 20 at a time, and it rotates. When someone graduates, I'll take another one but I want to be able to give you all of it. So that's why I have to limit my patients.
Yeah. And obviously for the IV therapy, you kind of have to be in person, so somebody local. Yeah. For Gaia Functional Medicine, do they have to be in the same town as you?
No, I'm licensed in the state of Florida. Mm-hmm. So I have my family nurse practitioner license, certified autonomous license in the state of Florida. So I can practice independently. So I can see anybody in Florida through Gaia Functional Medicine, and also my functional medicine certification. But if they are in Bureau, that's great, because then marrying the two with the IV, and that will be easier, but it's not impossible. We can still do the same thing virtually. So I don't want you to feel like you have to travel to Bureau if you want to. I'd love to meet you, but we can get you, anywhere you go.
Love it.
Mm-hmm.
Okay. Well, thank you everyone for listening. And thank you for coming, Jessica. We're definitely going to do it again.
Yes.
And if you guys, you can follow us on Instagram, Lynn D Photo, and then Kailyn, Green Goddess K.
Yeah, you know it.
So I'm not going to spell them out because we say them every episode. All right.
Thanks for listening.